Okay, in this video we're going to review some of the more simple parameters of inLab 4.0. So we're going to go ahead and go to our configuration screen and we're going to switch on our global parameters. Now to review, the global parameters are things that you'll have set. These are what the individual restorations are going to default to when you do that particular restoration. Like I said in the configuration video, there's many parameters here that can get a little bit confusing. So in this first video, we're just going to concentrate on the crown, inlay, onlay, and veneer parameters. So let's go ahead and hit crown. So many of the crown parameters are very similar to the chair side as if we scan through here. And I'm just going to go ahead and cover the ones that are similar first. I'll set them to what I have them set to with inLab. If we go to spacer, I like to have the spacer set at 120. My occlusal offset, I personally like minus 150. I know some have that different. Proximal contact strength I typically keep at plus 25. Occlusal contact strength I put at minus 25. Now the minimal thicknesses and the margin thicknesses, you're going to see it has a no next to it. If I click on all three of these, it says no. And basically what inLab does is it has a manufactured recommended thickness that it automatically defaults to. I tend to override this, so I'll go down minimal thickness radial and hit yes, and I'll override it, and I typically keep these at 700. So minimal thickness occlusal. I still override it, but it keeps it right at 700. And margin thickness, this one I'll override and we'll put at plus 80. Okay, so let's cover some of the parameters that are new. Consider instrument geometry. Now if we click on that, basically what this is going to consider is the overmilling. You'll notice in inLab there's no such thing really as veneer mode. It's consider instrument geometry, which means that the software will actually overmill as you usually want it to do to make sure the restoration fits. So if we look at the sharp area on the prep, you can see that it's overmilled nicely because I have consider instrument geometry clicked as yes. If I turn it off, you'll see now we have a binding spot there in red because it's now going to mill in more of a veneer type of mode. So we usually always, pretty much always have that clicked as yes. Remove undercuts. If we click that, now notice that typically in all restorations the undercuts will be blocked out and not milled in the software. However, if there's a situation where you want the software to mill an undercut for any reason, you would click this off, and now you're seeing that it's milling into these undercuts, not all the way, but much more. You're going to have some binding on the restoration if you do in fact have an undercut of your preparation. So again, typically I'll always keep this as yes. Now if we scan up to the top, you're going to see two basic shape, one for anterior, one for posterior. And basically what this is typically in the chairside software, everything is biogenerically proposed. Well, with the lab software, you have an option, we'll start with the posterior, to switch things to more of a database influence on the biogeneric. So right now it's defaulted as no, which I usually have it. If I click it to yes, you'll see now that it says juvenile. If I hit the scanner, it's going to go to adult, Asian. So if I want to have like an Asian influence on my biogeneric proposal, you can click the basic shape to yes and go to Asian, or obviously we can certainly go to adult or juvenile. So if I want a little bit more of a flatter proposal for an older patient, I may just have the adult on and have this influence my biogeneric proposal. So like I said, typically I will keep this as no. Now if I go to anterior basic shape, same type of thing. It's defaulted as no. If I click it to yes, I have a few different options. The first one's juvenile, adult, aesthetic, I think that means, athletic, so now we're getting to the athletic, and picnic, and Asian. So we've got a couple different influences that you can try on those more difficult type of proposals just to see if it gives you a better option. So those are the crowns. So let's move on to the inlays, onlays. So we'll click Inlay Onlay. In here are the inlay onlay parameters. So these are pretty typical of what chairside would be. I've got my spacer at 120, my adhesive gap at 60. Occlusal offset I have a little bit less. When I do inlays onlays I have that at minus 125. The contact strengths are the same, the minimal thicknesses are the same, but the only other thing that I do is I tend to increase my margin thickness here a little bit to compensate for my occlusal offset being negative, so I don't have that step at the cavo surface margin. So those are the parameters for the inlays onlays. We'll go to veneers. We'll click on the veneer. And here are my parameters for the veneer. Everything is exactly the same besides our consider instrument geometry and remove undercuts, which we talked about in the crown. I keep those at yes. I have my spacer a little less at 80. My veneer thickness is always at 500. I always have a 0 occlusal offset and a little bit of an increase in the margin thickness to help the margin survive the milling unit. So those are the parameters that you're going to use the most, and in further videos I will kind of cover some of these more in-lab features and the parameters associated with those.